Let's talk lip herpes, oral herpes, cold sores, fever blisters. They're all the same thing. Can you get it from sharing a blank? Can you get it from sharing a drink? Can you get it from sharing utensils? And for some of you people who share toothbrushes, can you get it from sharing a toothbrush? If you test positive for herpes, you are not alone. Here we learn, here we heal, and here we overcome. You are more than herpes. Welcome. Welcome to my channel. My name is Shayna Singleton, also known as the Herpes Goddess, also known as Coach Shayna Singleton. And my mission is to be at war with the stigma until our community feels comfortable being open about their status and proud of their sexuality. I am a life coach and I help women stop their outbreaks and break free from shame. That is my magic so that they can get laid. If you want to know more about me, please don't hesitate viewing this video right here. Now let's get into it. Let's talk oral herpes. For some reason, people think oral herpes is just HSV1. And let me clear the air right now. Oral herpes can be type 1 or type 2. You heard me? Oral herpes can be type 1 or type 2. Actually, according to the CDC and the NIDAD, who hosted a genital herpes workshop last year, November, stated that as of 2017, HSV type 1, herpes simplex virus type 1, is now the leading cause of genital herpes. Why? Because people with lip herpes, aka cold sores, aka fever blisters, who don't know that they have it, who don't acknowledge that they have it, can still pass the virus on to someone's genital during oral adult therapy. All right. So how transmission works for genital herpes, herpetic whitlow, herpes on your anus, herpes on your legs, your arms, your face. It's the same way herpes transmission works for oral herpes, aka lip herpes, aka cold sores, fever blisters. All right. So let's get into the topic on how is herpes transmitted. Herpes is primarily transmitted through direct skin-to-skin contact with the infected area, also known as the site of viral entry. The herpes simplex virus can be transmitted when there is contact between the mucous membranes or open sores of an infected individual and the mucous membranes of breaks in the skin of a non-infected individual. This close contact allows the virus to be transferred from one person to another. It is important to note that herpes can be transmitted even when there's no visible sores or symptoms present. This is because the virus can be shedding and potentially contagious. Therefore, practicing safe adult therapy and taking precautions, such as using barrier methods like condoms or dental dams, can help reduce the risk of transmission. Additionally, it is worth mentioning that herpes can also be transmitted through other forms of intimate contact, such as oral genital or anal genital contact. When the virus comes into contact with the mucous membranes in those areas, if you have concerns about herpes transmission or need more information, watch this video here. And I have to say it, but it's best to consult with a healthcare professional for personalized advice and guidance. Let's talk about herpes virus's survival. Its duration on surfaces and objects, okay? So the herpes virus can survive for short periods of time on surfaces outside of the body. But it's important to note that the risk of transmission from inanimate objects is generally considered to be very low. You don't have to worry about it. The exact duration of how long the virus can remain infectious on different surfaces can vary, and it is influenced by factors such as temperature, humidity, and certain conditions of the environment. However, herpes viruses are generally fragile and tend to die quickly when exposed to air and drying. It is recommended to avoid sharing blunts, cigarettes, drinks, utensils, toothbrushes, etc., with others to minimize the risk of transmission when experiencing an active herpes outbreak. It is best to replace your toothbrush to prevent the potential transmission. I keep talking about this toothbrush because I can't believe we out here sharing toothbrushes. No judgment, though. No judgment. I think I've done it in my past once. All right. Judge your mama before you judge me. Adult therapy contact. All right. Herpes is primarily transmitted through, again, skin to skin contact, particularly during periods of active outbreaks when the virus is more likely to be shedding. Using barrier methods such as condoms and dental dams, as well as practicing open and honest communication with adult therapy partners, can help reduce the risk of transmission. Let's talk about adult therapy toys. The lifespan of the herpes virus on adult therapy toys can vary depending on the material, moisture levels, and cleaning practices. It is important to clean the adult therapy toys thoroughly and follow the manufacturer's instructions for disinfection or use of barrier methods is applicable. Then I know we're talking about oral herpes, but I decided to talk about toilet seats because there's this myth that people are catching STDs on toilet seats all the time. So the risk of contracting herpes from a toilet seat is extremely low. The virus does not survive well outside of the body, and transmission through toilet seats is considered highly unlikely. I doubt people are if they're not experiencing outbreaks on their thighs or their anus, I doubt anyone is rubbing their genitalia across the toilet bowl. Like, I don't imagine anybody doing that to give someone else STDs or to receive STDs. But hey, that's just me and my little opinion. It is important to remember that most common mode of transmission for herpes is direct skin to skin contact with an infected area during periods of viral shedding. Taking precautions such as practicing safe adult therapy, maintaining good personal hygiene, and communicating openly with adult therapy partners can help reduce the risk of transmission. If you have certain concerns or questions, it is best to consult with a healthcare professional who can provide you with personalized advice based on your situation. Make sure you like, share, subscribe. Every Tuesday, I'm dropping a tip. Every Wednesday, I'm educating you about the virus like today. And every Friday, we are dismantling the stigma. Welcome.
I just want to say this too. I go to therapy and I've been in therapy for almost 3 years, and it's nothing like having someone who actually gets you on this level. So I just want to say I appreciate you. One thing that I've learned is from my own therapist is not about the actual school that teach you how to be a therapist and show up for people, is the real life experiences. So I just want to tell you thank you because this is doing so much. And so I even have therapy on Thursday before I came here, like to this group. So I just want to let you know it's certain things that we get, or I'll speak for myself, but that I can get from you that I can't get from someone else that doesn't walk and live in this world. So I just want to say I appreciate you and thank you very much. Thank you.